Well, hello, everybody. A pleasant good afternoon to you. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce, and welcome into our community conversation entitled COVID 101. We are glad you have joined us once again today and appreciate those of you that are finding us on our Facebook page and our YouTube channel, whether you're coming to us through the Chamber site or Keep Boone Healthy as well. As you all know, we have been involved in these conversations over the last couple of years of all of the things related to the COVID-19 pandemic, how it affects us from a community standpoint, how it impacts our businesses and how they operate and when they can operate even at times. But now we want to make sure that we have, again, more substantive dialogue going forward. So we are pleased to be joined today thanks to a partnership between the North Carolina Department of Health and Human Services, our partners at App Healthcare, which of course are our public health department here in the High Country area, and of course here at the Chamber. We have got an expert with us today to go through some of this conversation. Dr. Susan Consagra is a section chief with the North Carolina Division of Public Health. In this capacity, she oversees public health initiatives related to chronic disease, in addition to serving on the leadership team for the state's COVID-19 response efforts. Her previous roles include Deputy Commissioner of the New York City Health Department, as well as Assistant Vice President of Population Health for New York City's public hospital system. She's published extensively on public health issues related to chronic disease. Dr. Consagra has completed her internal medicine training at Massachusetts General Hospital, and she received her medical and business degrees from right here in North Carolina at Duke University. So we are pleased to be joined today by Dr. Susan Consagra. Thank you very much for lending your expertise to this very important community conversation.
Well, thank you so much, David. Such an honor to be here, and I really appreciate the opportunity to talk about this really important topic today. So with that, I'm going to go ahead and kick it off and start the presentation. And we're aiming for about 45 minutes or so, and we'll save the end for doing some Q&A. So again, thanks everyone for joining us today. So again, if you have questions as we go through, please go ahead and start to enter them into the chat, and we'll, won't be able to answer them in real time, but we'll get to them at the end. So first, let me talk to you a little bit about how COVID-19 is impacting North Carolina. And I know folks have been seeing, of course, all the data and statistics that are coming out, but specifically right now, we have about 1.3 million COVID-19 cases in North Carolina and over 15,000 deaths, unfortunately. Hospitals are not as full as they were in January, but are still very full. We have right now about 1,000 people currently hospitalized for COVID-19 and almost 300 people in the ICU. So still seeing significant impact to our healthcare system. And that's why getting the vaccine is so important. We know already millions of North Carolinians have gotten their vaccine. Eligibility has now expanded to kids 5 to 11 years of age. And that's why we need to continue to encourage more people to get vaccinated. And I'll go through the data to share a little bit with you on why and a little bit more about vaccines themselves. So first, just some terms that you should know that I'm sure folks are hearing across the news, but to lay them out ahead of time. CDC is the Centers for Disease Control, FDA, the Food and Drug Administration. These are the two big federal agencies that provide guidance, recommendations, and authority around things like vaccines. Emergency use authorization. This is a term that the FDA uses to authorize, for example, vaccines as well as other medical products. Coronavirus, we all know, it's a very large family of viruses. Some are very common and cause things like the mild cold, and then others cause serious respiratory disease, such as we've seen with COVID-19. Antibodies are the proteins that our body makes to fight COVID-19 and other diseases and really ramp up our immune system. And then monoclonal antibodies, you'll hear me refer to them as well. These are antibodies that are made in the laboratory to fight an infection such as COVID-19, and they're given to patients directly through a shot or an IV. So let me start off with talking about facts around the virus itself. So we know COVID-19 is most often spread in the ear by coughing and sneezing through close personal contact or touching your nose, mouth, or eyes, and then transmitting the virus on surfaces, though that's a less common mechanism of infection. Symptoms can appear anywhere from 2 to 14 days after being exposed to the virus, and the virus is always changing. And we know that now because we've seen, for example, the emergence of the Delta variant of the coronavirus, but there are other strains as well that are prevalent. But that is the main strain right now that we are seeing across the United States and in North Carolina. The Delta variant specifically, as I mentioned, has replaced other variants. It is spread more easily than previous strains of coronavirus and is about twice as more contagious as previous strains. The vaccines still work very well against the Delta variant, and that is the good news that we are seeing across this pandemic, that the vaccines are still highly effective, especially in preventing hospitalization and death. And that's why we're still really concerned about individuals that might be unvaccinated because they have the highest risk of getting infected and spreading the virus to others. Nearly all new cases of COVID-19 are in people who are not vaccinated. We're still continuing to see a pretty wide variation there between people that are unvaccinated being much more likely to get COVID-19 and to be hospitalized or die from COVID-19. Areas that have fewer vaccinated people are generally seeing more COVID-19 cases and people being sent to the hospital as well. And younger people are making up more of those cases as well. And that we will see start to shift, hopefully, as, again, more vaccines open up for younger ages. But that is currently what we're seeing across the state. And one of the other reasons that we are really encouraging vaccinations, not only to protect yourself from the acute illness, but also to prevent any long-term side effects. And we know with COVID-19, we are seeing something called long COVID. And long COVID is when COVID-19 symptoms continue 4 weeks after infection, and even after the recovery of the initial symptoms that you have. Some of the side effects, some of the symptoms that we're seeing with long COVID include things like fatigue, brain fog, headache, heart palpitations, which is an abnormal rhythm, fever, and muscle pain. And so again, these are lasting much longer than the initial infection itself. So now shifting a little bit to talk about vaccines. There are 3 types of vaccines available in the United States: Pfizer, Moderna, and Johnson & Johnson. These vaccines are tested safe and they're effective, and the FDA is continuing to monitor their vaccine safety as well. We know already that hundreds and millions of individuals across the United States have gotten their vaccine. And as I mentioned before, they're effective against the Delta variant of coronavirus as well. And all of these vaccines are incredibly effective at decreasing your risk of hospitalization and dying from COVID-19. So let me share a little bit about the history of vaccines by sharing a video with you. This is a few minutes long, and for those of you that want to check this out later, you'll see that there is also a code that you can scan on the screen as well. And these are on our website with the Department of Health and Human Services as well. Let me play this now.
One of the most common concerns that my patients have had about the vaccines is, how did they do it so fast? Everybody says it takes years to develop vaccines. And I honestly was interested in that too. You know, I'm as a primary care doctor, I talk about vaccines every day. I teach my interns about vaccines, and I was curious, like, what is the story with that? So I went back and read about the history of mRNA vaccines, and I learned that actually this research has been going on for decades, but especially the last 10 years. They worked on mRNA vaccines for other coronaviruses. There was one called MERS, and there was one called SARS. They didn't end up having to do that one because they were able to control those 2 coronaviruses. Every vaccine scientist practically in the world turned their attention to COVID. So you had all these brilliant minds working on it, and money was no object. They were just told, find the answer. And that's why we've gotten several different vaccines, and there are more in the pipeline, because nobody knew which ones were going to work when they started. And there was a prayer, really, that we would come up with answers, but we didn't know. And then finally, what they also did was the other investment was in producing a lot of vaccine without knowing the answer to whether or not it was going to work. So that if it didn't work, they would throw out the vials. But if it did work, it would be ready to ship out. And that's because that's been startling to people. Like yesterday it got approved, and today it's showing up in the pharmacy. That seems weird to people. But it's because that was the plan. They didn't want to then wait months for a working vaccine to have to be produced. And so when people talk about these vaccines as a medical miracle, it kind of is. It's a miracle of cooperation. It's a miracle of putting all that technology and that brain power together. This is the dream, really, that vaccine scientists have had. the idea that we would have to wait years for working vaccines while people are dying like crazy is horrible. So the fact that we were able to achieve working and very, very effective vaccines so quickly is really, has been like the holy grail. That's what we've all hoped for. And now going forward, I think that the technology that they've used in these vaccines are going to, what everybody is talking about, going to revolutionize vaccine science.
Great. So that again talks a little bit about the history of how these vaccines are made and answers that really common question around how did we get the vaccine so fast? Again, many processes were working in parallel. No, there were no shortcuts, but they were all working in parallel to get us to the point we're at now. So how vaccines work, again, vaccines act like COVID without giving you the actual virus. And what it's doing is it's giving your body the instructions it needs to make the protein, which is the antibody, to be able to fight off the COVID-19 virus. Your body then destroys the instructions in the protein from the vaccine, and the antibodies that your body keeps help to continue to fight off the real virus if it tries to attack you. So that's the short answer, but I'd like to share another video that goes through this as well.
Vaccines are supposed to train our body, train our immune system, and get it ready so that if we're ever exposed to an illness, a virus, a bacteria as well, our body's ready. We've made those antibodies, we've activated other parts of our immune system to attack it and prevent it from making us really sick. So that's really it. It's a heads up that we're giving our body. It's a chance to sort of practice, to make what's going to protect us in the future. And I think it's also important to remember it's a safe way to train our immune system. Some people tell me, well, doctor, why can I wait to get the disease? And then my immune system's going to react anyway. Aren't I going to mount the antibodies anyway? I just always remind them, yes, but you run some risks when you get the illness itself. The vaccine is a safe way to give your body a heads up without running those risks and those complications that you could get if you get the real deal illness.
So I know everybody has been hearing a lot about boosters, and let me tell you a little bit more about boosters themselves. So one is if you have received the Moderna or Pfizer vaccine, you're eligible for a booster if you've received your second dose more than 6 months ago and meet at least one of the following criteria. And you'll see that on the left side of your screen, which includes if you're 65 or older, if you live or work in a nursing home or long-term care facility, if you have underlying medical conditions, or you live or work in high-risk settings. If you received the Johnson & Johnson vaccine and you're 18 or older and vaccinated more than 2 months ago, the booster is recommended for everybody that meets that criteria. You can now what we call mix and match. So if you've gotten one type of initial series, you can still receive a booster of the other manufacturer. That's okay to mix those up. And you can talk to your doctor, nurse, or local pharmacy if you have additional questions. Once you're fully vaccinated, you can go back to many of the activities you enjoyed before the pandemics, but there's still some places where you should still wear a mask if you're fully vaccinated at this point. So continuing to recommend a mask in all indoor spaces, especially if you live or work in an area with high COVID-19 transmission, which is still pretty much all of North Carolina. We are seeing case rates start to come down, which is good news, and we might be out of a place where we have high transmission, but right now still pretty substantial and high in North Carolina. We should also continue to wear face coverings in schools, childcare centers, and indoor settings, public transportation, or very crowded, large crowded settings as well. And certainly, even if you get vaccinated, if you have symptoms of COVID-19, you should still get tested, because while it is less likely for you to get COVID-19 after you've been vaccinated, there is still some cases that do happen. So to find a spot to get your vaccine, you can do a few things. You can go to myspot.nc.gov, which has a tool to be able to find a location near you. You can also call the COVID-19 Vaccine Help Center, and you'll see the phone number there, and that's available 7 days a week to find a spot near you. And again, plenty of vaccine now across our state and thousands of locations across our state. So there's a place near you. At the vaccine appointment itself, you'll get a fact sheet that tells you more about the specific type of vaccine you're getting. You'll get your vaccination card, which is the proof of your vaccine, the date that you received it. And so make sure to keep that card in a safe place. And again, the vaccine is free to everyone. No government ID or insurance is required. You may get some temporary reactions after your vaccine. These things include sore arm, fever, headache, or just feeling tired or achy for a day or two. These reactions are a really good sign because that means your body is working to create antibodies and do the things it needs to do to be able to protect you from the virus. Serious side effects from the vaccines are extremely rare, and most have been temporary and treatable. And it's important to remember that you can also take over-the-counter medications such as Tylenol or ibuprofen if you need help with those temporary reactions. You know, we talked a lot about vaccines, but let me spend a few minutes on testing as well. So again, still really important that if you have signs or symptoms of COVID-19 to get tested. That really helps to detect a virus early and keeps it from spreading fast. And it's also important because now there are treatments for COVID-19 if you do have COVID-19. So it's, you know, very quick and easy now. There is testing again across our state in thousands of locations. We have many no-cost community testing events. We also know that there's many pharmacies and other providers that are doing testing. You can actually go to a pharmacy and also pick up an at-home test you can do yourself. And you can also request a no-cost COVID-19 home collection kit as well off the North Carolina DHHS website. So many different ways for you to get tested if that's a need. And again, that's important because if somebody is positive for COVID-19, there are treatments available. One of those is monoclonal antibodies. And again, these are made in the laboratory to fight infections, in this case, COVID-19, and they're given directly to patients through either a shot or an infusion. These treatments help reduce the amount of virus in the body, which means that it leads to less severe illness and decreases your likelihood of having to be in the hospital because of COVID-19. So there are certain criteria for who are eligible, including high-risk adults and youth, 12 and over, who have, for example, chronic conditions that put them at higher risk. So if you do, end up seeing yourself in a place where you have COVID-19, this is something to immediately talk to your doctor about and see if this treatment is right for you. So in the last few weeks, we know that COVID-19 vaccines are available for children now, ages 5 to 11. So kids have a spot to take their shot. And this is really important because we know that kids can get the COVID-19 virus just like everyone else. And some children do experience those long-term side effects of COVID-19. And while also hospitalizations and deaths have been lower in this population, there still have been hospitalizations and deaths. During the most recent surge, pediatric cases of COVID-19 rose by about more than double in the US. And so again, really important that we help our school-age kids get vaccinated and help them get back to school safely and stay in school, which we all know is our key priority and key goal. So if you look at the clinical trials for kids, there were more than 3,000 children ages 5 to 11 that participated in these trials. And those trials showed that the COVID-19 vaccine was safe and effective. There was no serious safety concerns or serious side effects noted in that clinical trial and study. They did show temporary side effects, much like adults see and much like you see with any other type of vaccine. Things like, again, the sore arm, fatigued, feeling achy. And they also found that the vaccine was 90% effective in preventing COVID-19 in children ages 5 through 11. So again, really high effectiveness and very low side effect rate. They did include trials. They did include volunteers in those trials from different races and ethnicities, and you'll see some of that data here. And children in these trials were given 2 doses. Each dose was about 1/3 the amount of the dose given to 12 and older. So in the same way that these vaccines protect adults from COVID-19, they act in the same way to prevent COVID-19 in children as well. After your child gets the virus, the vaccine gives their body instructions to make a protein that helps teach their body to fight off the real COVID-19 virus. Your body then destroys the instructions and protein from the vaccine. And again, these antibodies help protect you if you were to get the real virus and you already have the protein ready to attack the virus. The temporary side effects that I mentioned from the COVID-19 vaccine for kids 5 to 11 were, again, similar to the side effects seen in older adults. These temporary risks include sore arm, headache, feeling tired or achy for a few days. An extremely rare side effect that they've seen in older adolescents and young adults, but have not seen in young children so far, is called myocarditis, and that is an inflammation of the heart muscle. Myocarditis cases have mostly been mild, and people usually recover on their own or need minimal treatment. And no cases of myocarditis were seen in children ages 5 to 11 in the clinical trials. And that, again, is really important because even physiologically, myocarditis is associated with androgens and hormones. And so we see those in older ages, not younger ages. And so just an important point to also keep in mind. And there continues to be very robust surveillance for these vaccines from the beginning, and they are continuing as well. So currently only the Pfizer vaccine has been authorized for kids 5 to 11. Again, it's a smaller dose than the adult vaccine, so it means not every location will have them. You can, again, go to our website to look across and find locations that carry the Pfizer pediatric dose, and we have over 800 locations in North Carolina, so plenty of vaccine is available across the state. Again, always free, even if you don't have insurance and regardless of your citizenship status. Parental consent is required, so just important to keep that in mind. And we already know that vaccines for adolescents are available as well. Any teenager 12 and up can get vaccinated with the Pfizer vaccine. It's fully approved for people 16 and older as well. So again, to remember, as many of these sites are now offering, vaccinations for the entire family. So good conversation to have with your teen and your children as you continue to see this vaccination rates go up. So lastly, let me just go over a few frequently asked questions. So one is oftentimes we get asked about post-vaccination cases or breakthrough cases. And so we know even though that the vaccine is highly effective, and this pertains to all vaccines, the small number of people who are fully vaccinated will still get disease. And that is the same that we see with COVID-19. And post-vaccination cases are expected because, again, even though vaccines work well, they're not 100% effective, but they're, in this case, highly, highly effective. So that doesn't mean that the vaccines aren't working. In fact, if you look at our data, you are 467% more likely to contract COVID-19, which is about 4 times more likely, and about 20 times more likely to die of COVID-19 if you're unvaccinated. So again, still highly effective. Many times we get asked if by women that are pregnant or breastfeeding if they can get the vaccine. And yes, the vaccination is still recommended for all people, including people who are pregnant and breastfeeding or trying to get pregnant or might become pregnant in the future. And so this is a recommendation, especially because we know in pregnant women, they do have a higher risk of being hospitalized for COVID-19 and a higher risk of needing the intensive care unit. We often get asked, should I be concerned about the impact of the vaccine on fertility? And so here again, the answer is no. Even if you're planning to become pregnant, you can still receive the COVID-19 vaccine. In fact, it's recommended both by the CDC and the American College of Obstetrics and Gynecology for all people, including those who want to get pregnant. And women in clinical trials successfully became pregnant following vaccination. So there's been no data to suggest that the vaccines impact the ability of a woman to get pregnant. And in the same token, the Society for Male Reproduction and Urology has also recommended it for men. Conversely, on the flip side, there have been studies that show that the COVID-19 disease itself can lead to many different side effects or many different adverse effects, including, for example, erectile dysfunction. So again, some of the data here and supported by major medical bodies around the effectiveness of vaccine, and also continuing to recommend it for men and women who are thinking about having children. And then lastly, how do you access your vaccine records or proof of COVID-19 vaccine? So you'll see a link at the bottom. That's the COVID-19 vaccine portals. where you can get your information. It's really important you provide your email address when you get your COVID-19 vaccine, so that if you do need to retrieve it in the future, you're able to do it through the portal. This includes data for anyone in North Carolina who got it through a North Carolina provider. For those individuals that got it through a federal retail pharmacy program, such as CVS, Walgreens, or Walmart, you'll need to get your information directly from the provider themselves. And then last question is, do people who have had COVID-19 still need to be vaccinated? And the answer here is yes, you should still get vaccinated even if you've already had COVID-19, because the vaccines do work to protect you against a future infection. And there's a lot of new studies that are coming out on this, and the CDC is still continuing to recommend that vaccines are highly effective and still protect even those that have had a previous COVID-19 infection, because we don't know how long, if you've had COVID-19, we don't know how long that protection lasts. And, there's indication that that also will wane with time. So a recent study showed that among people infected with COVID-19, those that were unvaccinated were more likely to get COVID-19 again than those who were fully vaccinated. So that was the last FAQ. There are some resources on our website for those that are interested, again, to go to the vaccine location finder tool to find places that offer vaccinations. We also have a video library there where you can see some of the videos and others that I've shared. There's a website specific for teens and kids that has more information, especially some of the newer information in the last few weeks. And again, more information there on treatment. So I will pause my presentation there, and I'll turn it back over to David so we can kick off some Q&A. Thanks.
Excellent. Thank you, Dr. Consagra, as you laid this out so well for those that have had this conversation on their minds for a while and feel that this is a great refresher. I think we take for granted sometimes that as much as we've been talking about this from a community standpoint, not everybody has gone down this road yet. So laying out some of those basics, certainly helpful, but also talking a little bit some about side effects and some of the issues that people may see as they go through this process. And that's kind of where we start with the questions. So let me reiterate how we can communicate here. We do have 3 different ways that you can get questions into us for this Q&A with Dr. Consagra. First and foremost, if you are watching on Facebook or YouTube, you can just type your questions right in the chat function of either one of those players, and we will see those and get to those accordingly. And thanks to Katie Green for helping moderate that for us from our staff's perspective. You can also email us if you prefer to send your question in that way a little bit more anonymously, and you can do that at info@boonechamber.com. And we've actually got a couple of questions already queued up from that resource. So we'll start with those. And the first one centers around booster shots. One of our employers here in town wondering if the booster shot reaction is similar to what they saw with second shot reaction, and really kind of asking this from a scheduling context of, should employers really think about scheduling their employees some time off immediately after a booster shot to make sure that we're not working into a staffing negative, if you will, by having multiple staff members go and get those boosters at the same time?
Yeah, sure. That's a great question. And I know, right, certainly came up when people were getting their second doses as well. And so, people vary widely in their reaction even to boosters. Some people don't have any symptoms, do fine. And some people do experience those mild temporary reactions that I mentioned earlier. It's always good to remind folks that, they can take things like, Motrin, things like acetaminophen to help decrease any effects afterwards. And that oftentimes will help people, get through the next 24 hours or so after their booster if they do end up having side effects. And, certainly it's always nice to consider spacing out if you can, and just thinking about and planning for that week and being prepared for, that next 24 hours you might not be feeling as well. And so it's always good to consider that in mind. But again, remember, temporary, one day, treatable. Again, there's over-the-counter medicines you can take should you have that. So certainly, can be considered, but it's about what we saw for second doses as well.
We've got a couple of questions coming in on our online chat, and we'll get to those in just one second. I've got somewhat of a follow-up to that. And, as we are thinking about boosters now, and certainly many in our community have already come through their first and second shots, can you, or in your opinion, do you feel like this will become more of an annual thing? where like flu shots and some of the other vaccines that we get, do you feel like that there's at least a possibility of this becoming a little bit more of our routine healthcare regimen?
Yeah, we'll see what happens. And I think, one of the things that's been happening now is there's been studies that look at immunity over time. And so certainly that was the data that led to the FDA authorizing a booster 6 months after, because they saw, some waning there. And so I think now, again, folks are getting boosters. There's ongoing studies that look at immunity, and we'll have better information. I think that could be, certainly could be a possibility that, turns into a yearly recommendation, but we need to wait for the data and see what that data shows, before we can make any determination there. And that's really up to the FDA and the CDC experts to look at that.
Our next question comes in from our Facebook chat. And again, remember, you can write these in on Facebook, on YouTube. You can email us at info@boonechamber.com, and we'll get these questions here in this great opportunity to talk with Dr. Susan Consagra here today about COVID 101 and all of the questions that we may still have despite dealing with this for quite some time now. Kenny Ballman writes in a great question, very topical one here. In the town of Boone tonight, on the as we record this or have this live on Tuesday. So remember, if you're watching this in archive, this may have already happened. But on Tuesday evening, the Boone Town Council will be discussing their current COVID state of emergency and any adjustments that they may need to be made to that policy based on trends and other factors. The town of Blowing Rock went through a similar exercise last week and elected to leave their state of emergency in place as it was. Kenny's question is, given the rise in cases across the country and world, do you think it's wise for Boone to drop a mask mandate at this point? So I'll maybe ask, in addition to that, how is DHHS and other state agencies working with municipalities to help them make informed decisions about those types of rollbacks and mandates, or leaving mandates in place, or any conversation in that way?
Yeah, that's a great question. And, right now the recommendations around masks come from the CDC and are really based on your community transmission rate. And so they look at cases per 100,000 individuals, and depending on the level in which you are at, make that recommendation around masks. And what we saw happen over the last several months is the entire country reaching the highest level and substantially exceeding the highest level on the CDC scale of high transmission, which, the recommendation there was for folks to wear masks indoors, all individuals. And so, we will see where case rates continue to go. We have seen a decline, but we have stabilized in the last several days. And so it'll be really important to watch that as we move into the future to see whether that stays where it's at, whether that continues to go up. And we're entering what we typically, see as respiratory viral season now into the winter and the colder months. And so we'll have an opportunity to see, we're starting off a higher baseline than we did last winter. Of course, we're also seeing many more individuals vaccinated. So we'll have to continue to look at those case rates slowly. But right now, under, CDC guidance, there is a recommendation for individuals to wear masks in areas with high and substantial community transmission, which is pretty much still all of North Carolina.
You bring up an excellent point toward the end of your response there that leads into the next question that we got submitted at info@boonechamber.com. And that talks about the difference between the level of vaccination versus where we were at this point in time last year. And the question simply asks, are more people vaccinated to the point where maybe some of the restrictions around family gathering would look different as they did last year at these key holiday times? I know you addressed that briefly, but could you expand on that kind of suggestion at the CDC level, and maybe even where some of the trends indicate that where people might want to place some of their safety and precautions in and around family gatherings coming up here?
Yeah, and I think, as we go into the holiday season, it's so important, the ability to gather with loved ones. And we know that's been really difficult over the last year and a half. And so, the important thing here is to continue to follow the CDC recommendations and do, there's many different strategies, and we have to layer those strategies. And so as we head into these months, think about what you can do. Again, first and foremost, most important thing you can do is to get vaccinated. We know, again, so highly effective and decreases your risk of getting COVID-19 by 4 and decreases your risk of hospitalization or dying from COVID-19 by 20. So that is really the most effective tool that we have to protect ourselves, and we really encourage folks to do that. Second is obviously considering testing anytime you have symptoms, or even, before, large gatherings, consider getting tested before, after, that's still available. And then obviously continue to wear masks. mask. So right now, those strategies are all still, recommended. They're out there and available. We need to continue to use those strategies and implement them in a layered fashion. But we will see again where cases go. And I think we're at a point right now where since cases have started to decline rapidly and are now stabilizing, it's going to be really important to see what happens over the next few weeks.
That brings up a great opportunity to insert a follow-up question from Kenny Ballman from his initial conversation about the Boone Town Council decision that they have tonight, if they should decide to take any action or leave things as they are. Remember, this is just a conversation on the agenda this evening. But that question gets back into that transmission rate and what you consider a dangerous transmission rate. And maybe you can explain a little bit about that high, moderate, and low transmission scale that we've seen. Because we've been in high for so long, it's hard to remember what the other levels are.
Yeah. So again, CDC has 4 levels: low, moderate, substantial, and high. And they have different transmission rates for each of those levels. And so, for example, over high is over 100 cases per 100,000. And so you can look on there, and they use 7-day averages in the last 7 days. So you can look on their website, and they actually have a color-coded map that looks at the entire country and shows transmission rates across the U.S. and shows the level at which they're at. But that's a scale that we're talking about right now that we have been using. And I think it'll be important too as we continue to progress in the pandemic, especially as more treatments become available. We're hearing more about other additional antivirals that might be out, pending study from the FDA and CDC. We might be able to look at it differently in terms of looking at our hospitalization rates and looking at severe cases. But right now, we are still continuing to look at cases. That's been one of our important proxy measures.
Popular question. We've gotten it emailed twice in the last 20 seconds. Do you recommend getting a flu shot before, after, or during your window of getting first and second shots of the COVID-19 vaccine?
That is a great question. And really, you can get the flu shot at any point. You can get it with your COVID-19 booster or vaccine, if that's, most convenient for you. You can do it before, you can do it after, any of those things. And so, important message there also to just get your flu shot as soon as possible. And we know, again, that's important because we're heading into respiratory virus season. It's hard to distinguish flu from COVID-19 because you get many of the same symptoms: fever, runny nose, cough. And so, either way, it will help protect you not only from flu, but from having to do those things to also test yourself from COVID-19 if you're preventing a case of the flu. So for all those reasons, really important. It's also really important because, as I mentioned before, we know that in North Carolina, we're still seeing even today, we have about 1,000 hospitalizations for COVID-19. And so our healthcare system is still strained by COVID-19. And when we head into respiratory virus season, flu also adds to the strain that our healthcare systems experience because more people will come in for flu. And even though severe illness is less common, it still is something that can be seen with flu. And so for both those reasons, we want to protect the people around us. We want to protect the community. We want to protect our healthcare workers in our capacity of our medical system to deal with other issues. It's really important to get the flu vaccine as well.
I think it's important to note that science has not stood still since the start of this, and there are constant new strategies and new methods being thought of in terms of treatment and some of the testing strategies. All of this is continually under the microscope to examine how we best move forward in terms of best practices. So with that said, a lot of folks remember some of that early conversation around treatment options when hospitalized, and there was so much attention paid to the ventilator aspect of that, right? Because that was the most, that signaled the most severe case. And then that was kind of the worst possible scenario for anybody in terms of that need for services in terms of hospitalization. Can you talk any more about kind of the evolution of some of those treatment methods and what the average hospitalized COVID-19 patient is seeing in terms of available treatment options when they do go into a facility and hopefully get treated well enough to come out soon?
Yeah, sure. One of the things that we are seeing in the evolution of treatment is the monoclonal antibodies that I talked about earlier. And that's really important. And it's important before people end up in the hospital. It's something that you provide in the first, early on in the course of illness, which is why it's important to be tested early. And it actually decreases your chances of ending up in the hospital. So that's been, one of the things that we have seen that we didn't have at the, early on in the pandemic. We do have it now, which is great. We're seeing new types of monoclonal antibodies authorized for use in the US. And so we've seen that evolve. It used to be that they were only available through IV, which made it, a little bit more intensive to get that because you had to go into a provider that would do an IV infusion. Now they're available as an intramuscular shot as well, so that makes it a little bit easier to administer. And we're going to continue to see evolution in treatments available. Again, we're already hearing about, for example, antivirals that might be approved. They still need to be looked at by the FDA and CDC, but we're seeing that progress and some of the science there and technology evolve there in that sense. So I believe we'll continue to see that as we go forward.
We're getting ready to get into the holiday shopping season. And last year at this time, we saw so many retailers dealing with everything from spacing out products to limiting the size of crowds inside stores. And a lot of that was tied toward thoughts about surface to surface spread or just the close proximity spread within numerous people being in a tight space. Have you seen any of the guidance around that same type of activity change in the last year? Or maybe put another way, should we expect to interact with these businesses in any different way than maybe we did a year ago? Or should we anticipate some of those same measures put in place from a retailer standpoint as we get into the holidays?
Yeah, so, that surface contact over the last year and a half, they've seen that is a lesser mode of transmission. There still can be some transmission through that mode, but it's by and large spread through the air with respiratory droplets, coughing, sneezing, and that is a primary mode of transmission. And so certainly it's still really important, as individuals go out, still, recommend hand sanitizer, washing your hands, before you eat, doing those types of common sense measures. But we know primarily one of the main reasons it spreads is through the air, coughing, sneezing, which is why, again, the mask is really important for now until we see our community transmission rates start to go down.
I'm just wondering, kind of anecdotally, how much less sickness have you seen with masks? We've heard anecdotally around the community here that there's less strep throat going around, for instance. But have you seen a drop off in other illnesses because of that?
Yeah, it's interesting because when we looked January of last year and looked at, for example, flu rates, we saw much lower rates of flu because of all the measures that were being put in place for COVID-19. And so we're seeing that effect, that's masks and probably many other things too, sanitizing hands and thinking about, exposures and people taking other measures to also mitigate their risk of COVID-19. So we did actually see that impact. And I think going into this respiratory season, we'll see the impact as we go forward on flu and some of the other things as well.
We appreciate your time so much. I've got one final question for you, and then unless we see any others pop up in the chat or pop up in our email inbox, we'll let you go about your afternoon. And again, sincerely, thank you for lending your expertise here today. We often hear in the media and in other channels about what's going on right now, what measures are being taken right now. But we also know that there is predictive work that is being done in various circles and conversations and labs throughout the state and world, for that matter. If you were to put your crystal ball out there right now, what's the next thing we need to be paying attention to with this? Because we have seen so many different benchmarks over time. What are you looking at next, and what should we be paying attention to as a community?
Yeah, well, certainly, we've been in a pandemic phase, and we need to think about how we move into the endemic phase, which is how we live with the virus. It's not going to go away. And so that's the shift that will be happening over time, especially as we have more people vaccinated, we see less severe illness. We'll still continue to have the virus amongst us, and thinking about how we shift into that phase is going to be, the next challenge for us and phase of work for us. So, I think we all have learned, if we were here 3 years ago, none of us had the perfect crystal ball to know that this was ever going to, be here and with us, and this is what we're going to be dealing with. But it is. And so that's something we're going to have to continue to figure out as a community and as a society, how we manage. But again, most effective tool, if I could leave one last word, vaccines. That's our most effective tool to get us out of the pandemic phase and get us more into an endemic phase. Vaccines are our most effective tool.
Well, we've been so fortunate here in the High Country to have such great partners working on that vaccine deployment, whether it is partners like Boone Drug Incorporated, certainly App Healthcare, our local public health provider, has done great work there, Appalachian Regional Healthcare System. So many providers now, so much more access, especially as we come around to boosters. Remember, if you were vaccinated early on in the process when it was so important to get an appointment time and you had to kind of drop everything and go get a shot if you could get one, access is a little bit different this time. So just keep that in mind as you're going about that. And I think one final thing to mention as we close down our conversation around this, and I'll kind of point back toward the town of Boone having their conversation about their COVID state of emergency tonight. Blowing Rock just did that as well. As municipalities are having these conversations around our region and around the state, it is important to remember that just because a community drops a mask mandate doesn't mean that all businesses have to adhere to that. It is a business's right to still put in place any policies that they may want to, and they expect to be backed up by those municipalities and helping them police that. So keep the mask in your pocket should you see any changes in any communities here, or maybe those that you drive to. I know that Guilford County made some changes to their policies yesterday, as a matter of fact. Keep that mask in your pocket because there still may be a business out there that requires you to wear a mask as you come inside. And in order to do business with that business, you have to apply by their rules, kind of the no shirt, no shoes, no service policy that will kind of come back around again once we see that these things maybe aren't universally looked at as much as possible. We appreciate the municipalities having conversation about this and being transparent with that conversation. And hopefully we'll get some good community guidance tonight and see where the town of Boone Council decides to take this here locally and help us set policy for the rest of the region. So Dr. Consagra, we again appreciate your time here today and expertise. And we look forward to engaging with North Carolina's Department of Health and Human Services and App Healthcare more as these opportunities for conversation come up again. So thank you very much.
Well, thank you. Appreciate you hosting this conversation and making time for it. Thank you.
Excellent. Again, for those of us here at the Boone Area Chamber of Commerce, we thank you for joining us today. And remember, too, that this conversation is fully archived. So if you joined us in the middle or missed part of it or had to step away for a moment, just come right back here to our Facebook and YouTube channels, and you can grab that right away. And we'll send this out to our full membership a little bit later this afternoon as well. For now, on behalf of our entire team here at the Boone Area Chamber, we say thank you. Have a great afternoon and bundle up.